Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. According to the Centers for Disease Control, half of all sexually active young people will get a sexually transmitted disease, or STD, before the age of 25, and most will not know it. Today, we'll talk about what's being done in our community to treat those with STDs and to help stop new cases from occurring. With me today are Thurman Hoskins Jr., a community resource specialist with the Lincoln-Lancaster County Health Department, and Lee Heerten, educational coordinator for sexual health at the University of Nebraska-Lincoln. Let's start with Thurman. How are you today?
I'm fine, thank you.
Good. So what exactly is a sexually transmitted disease?
Sexually transmitted diseases come in two categories, actually, bacterial or viruses. So when we're talking bacterial, we're talking gonorrhea, chlamydia, syphilis. And when we're talking viruses, we're talking more or less like the HIV, herpes, genital warts, those kinds of things. And with viruses, there's no cure, so all we can do is provide treatment. And the one thing I think that people look for is symptoms sometimes to sexually transmitted diseases when sometimes there may not be any symptoms at all. What we want folks to know is if I've had unprotected sex, that's the risk. How do you acknowledge the risk? And because of that risk, it could lead you to those sexually transmitted diseases. Syphilis is on the rise right now. It's actually running as a co-infection with HIV, so we're seeing a lot of co-infections that include HIV and syphilis. Sexually transmitted diseases have been here for many years, and it hasn't gone away, and it's not going to go away unless people decide to take some action in reference to protecting themselves and their families.
What's the most common STD that we're seeing here in our community, and what should people know about it, such as symptoms and things?
Well, one of the most common STDs that we are seeing, not only in Lancaster County but nationwide, is chlamydia infections. For whatever reason, there's a certain age group that is being truly affected by this between the ages of 15 and 24. So that's probably the most common. Syphilis is on the rise, though, again.
So how is the health department involved, and what sort of message are you trying to get out to the public?
Well, the health department is involved in many ways by offering testing, and we've actually included a new testing option. It's called the STD Express Clinic. So our testing sites are Tuesdays and Thursdays, Tuesdays 1 to 3, and Thursdays 5 to 7. So we try to provide easy outlets or access to our testing. The message is basically people should get themselves tested if they feel and acknowledge what the risks are in reference to what STDs are. So know the risk, know it puts them at risk, and come see us.
Okay. What options does somebody have for confidential testing?
It's all confidential. It's all confidential. In fact, the ages are between 12 and up that we can see clients. So if a young person comes into the STD clinic, they don't have to worry about their parents knowing about it as far as feeling safe. In reference to testing, or excuse me, in reference to treatment as well, we don't refer to their parents as far as what medicines they may or may not receive. So it is confidential, and confidentiality is really one of the things that we strive to enforce, as well as to let the community know that we're a part of and strongly believe in.
Okay. Now, who do you see come through your clinic?
Oh, wow, that's a very good question as well. We see all kinds of folks that come through our clinic. As I said, the age is primarily between 15 and 24, but people who are just going back into the dating scene, for instance, people who perhaps have been married for some time or have questions about their partner's health as well as their health, they will come in and see us. So we don't want to imply that it's a young disease, because anyone can get it based on what they do. So if anyone puts themselves in a position to have unprotected vaginal, anal, or oral sex, that's considered a risk for STDs.
Okay. Now, where can somebody find more information, some resources about STDs?
Well, I think we've got some sites posted, I believe, and we have a website, www.lincoln.ne.gov. And there's also 441-8065 is our information referral number. Or they can call me at 402-441-6248.
Okay, very good. Now let's chat with Lee for a minute. For the 20 million new STDs in the U.S. every year, half of them are young people under the age of 25.
Yes.
So what is being done at the university level with education, and what challenges are you facing there?
Yeah, well, we have a focus on a couple different areas. One is prevention. So we want to give young people the tools and resources that they need to not get an STD. On the other hand, we also have clinical resources for young people who think that they might have an STD or who have been diagnosed with an STD. I think the biggest challenge that we face in either of these realms is fighting some of the stigma and the shame associated with having an STD or perhaps being at risk for an STD. So that's where a lot of our educational messaging is focused on reducing that shame and reducing that stigma, making it easier for young people to access preventative or clinical services.
Okay, what are some of the biggest misconceptions that young people have about STDs?
Sure, well, the biggest one is young people think that they're invincible and that nothing bad can happen to them or ever will happen to them. And that's a hard one to challenge because developmentally that's where they are. But it's also reinforced because young people aren't talking about getting STDs or getting treated for STDs or trying to prevent STDs. And so it reinforces that idea that nobody I know has ever had one, so it can't happen to me either. So trying to get a conversation started with young people around STDs, condom use, responsible alcohol use, all of those things are really important in countering that misperception that it won't happen to me. So a lot of the work that we're doing from an educational perspective is trying to correct ideas about what's normal for young people. I think there's a misconception that college students are going out, they're getting drunk every night, and then having high-risk, unprotected sex. That's this popular conception of what young people are engaging in, and we see it in movies, we see it in TV all the time. But we know from the research that that's not true. That's not the norm for most young people. Most young people are really responsible with their alcohol use. Most young people are either not engaged in sexual activity or are taking steps to make sure that they're reducing their risk for STDs. On the flip side of that, I think there are a lot of misperceptions about who this does happen to, that it happens to people who have more sex than me or who have different types of sex than me. It happens to those people over there. And so challenging some of those myths and misconceptions that it really can happen to anybody, anybody who's sexually active can be at risk if they aren't taking precautions, if they aren't using condoms, etc.
Now, what can parents and educators do to better educate and prepare youth?
We can be having open and honest conversations with young people, which I know is really challenging for many educators, for many parents. It can feel uncomfortable, it can feel a little scary, but we really do need to have those open dialogues with young people. Young people, in my experience, are really hungry for people to talk to about these things, for safe spaces where they can have conversations, and we aren't giving those to young people in systematic ways. So being an open person, being somebody that is an askable adult is so important to many young people. So I think that's the most important thing that we can do. And I think also, in addition to conversations around STDs, sexual activity, talking to our young people about responsible alcohol use and what that looks like. So much risk-taking, especially on a college campus, is fueled by alcohol use, irresponsible alcohol use. And if we can be having a dialogue about that at the same time, I think that'll really help us in multiple realms.
Very good. Now, what resources are available to university students?
Well, at UNL, we have the University Health Center. We have a fully staffed medical clinic with testing and treatment options available for students, all confidential. We also have a pharmacy on site, so students can get any medications that they might need. We also have our education department is located there, and we have a lot of resources for students in terms of prevention, safer sex supplies. We also have a counseling and psychological services office. A lot of students can be very upset when they find out that they have an STD. They aren't sure how to talk to their partner about it. So we have some good resources to help them through those situations as well. In addition, we have an HIV testing site that is that's out of the building in the Gone Multicultural Center. So we do free, anonymous, and confidential HIV testing there, along with peer counseling. So young people can talk to somebody their own age about ways that they can reduce their risk for HIV.
Great, very good. Well, thank you both for coming. This is really important information.
Thank you.
Thanks.
Thank you. Now, when we return, we'll discuss some other things that are serious issues for youth.
This is Max. 13 years from now, he'll try pot for the first time because he just wants to fit in. This is Katie. 12 years from now, she'll find a new group of friends and start skipping school. This is Aaron. 10 years from now, he'll be bullied by his classmates and become withdrawn. Raising kids is hard. It's okay to ask for advice. Call 888-866-8660 to speak to a trained counselor. Any problem, anytime.
Welcome back. I'm Clover Frederick, your host for Shape of the City. According to one study, underage drinkers in 2009 consumed nearly 26% of all alcohol sold in Nebraska, more than twice the national average and the 5th worst in the nation. So what is being done to help bring down those numbers? Joining me today is Teri Vosicky, the Lancaster Prevention Coalition Chair. Thanks for joining me, Teri.
Good morning, Clover. Thank you for having me.
Absolutely. Now, what do we know about youth drinking in Nebraska in our community?
What we know is nationally, while underage drinking has fallen about 6%, in Nebraska it's actually risen about 6%. Further, a 2011 study from the Pacific Institute found that in 2009, drinkers, as you referred to before, actually consumed about 26% of the alcohol sold in Nebraska.
Now, what do we know about binge drinking overall?
Binge drinking, first of all, is defined as more than 5 drinks for men or more than 4 drinks for women in a 2-hour period. This would then raise your blood alcohol level to about the legal limit, which is 0.08. So in a 2-hour period, to put away that much alcohol is what the CDC classifies as binge drinking, the feds. Binge drinking in Nebraska is higher than in other states. We do know that binge drinking costs the U.S. itself $223.5 billion in actually just across the board. It costs federal, state, and local governments actually about 62 cents a drink, while we get 12 cents in taxes from that. So binge drinking, the costs that we're talking about missed work, we're talking about intentional injuries or unintentional injuries, we're talking about unintended pregnancies, that kind of thing. Okay.
Now, what are the effects of starting to drink alcohol at a younger age?
That's really kind of shocking, and I don't think a lot of people realize this, but if a youth were to start drinking under the age of 15, they are 4 times more likely to develop an addiction down the road, and they are actually 2.5 times more likely to abuse alcohol later in life after they're 21 than those who start drinking after the age of 21.
Okay. Now, what are the effects to the community more than when more youth are drinking alcohol?
Right. Well, again, we're talking about things like unintended pregnancies, property damage. We're talking about missed work, school dropouts, that kind of thing. So it certainly is an issue for everything, and it's something that can be handled by actually, parents just talking to their kids about alcohol.
Okay. So what are we doing right here in our community to cut down on alcohol consumption?
The Lancaster Prevention Coalition is made up of 8 community groups that are based in the high schools, but are actually communities based around the high schools that are utilizing parents, school staff, and administration to address underage drinking in Lancaster County. So we're coming together and we're looking at the resources schools need, we're looking at the resources neighborhoods need, and we're helping them with grant money from the feds to access resources to do intervention strategies within their communities. So all those big words mean we're actually getting together as volunteers, and we're looking at ways to, whether it's an activity like a 5th quarter dance, or whether it's introducing a Creating Lasting Family Connections class, which would give parents parenting tools to know how to have a conversation with their child about alcohol use or drug use. I mean, whenever we say have a conversation about alcohol, it also implies that we're talking about other risky behaviors, whether that's drugs, alcohol, sex, or whatever. So we have these community groups around around Lancaster County that are involved, and that's what we're doing. We've got a new grant called the Partners for Success Grant that has allowed us to create a website called talkaboutalcohol.org. This website has tips for parents and actually an interactive tool that parents can use to kind of judge what parenting style they are, walk them through the 4 parenting styles, and then help them identify what they need to tweak in their message to deliver that or to have that conversation with their child and have that conversation be a little more effective.
Oh, that sounds really useful. Now, what is the responsibility of adults in cutting down youth alcohol consumption?
I'm glad you asked. Actually, 83% of youth have reported that it's just having a conversation or knowing their parents' expectations that keep them from using alcohol or waiting till later to use alcohol. So it's extremely important. I know it's an awkward conversation sometimes for parents to introduce that topic of conversation, but it's not so much a lecture as it is a conversation or listening, asking them what they're seeing at school. So, just taking a moment to sit down with your child and say, are a lot of your friends drinking? How do you handle that? What do you think about that? How do you think that might affect their performance later? So just taking time to be with your child and to have a conversation is one of the best things that you can do.
Very good. Now, this couldn't all be done without some community partners, right?
Excellent,
so tell
yes.
me about the community partners.
Well, with this grant, we have brought a lot of people to the table. We still have those 8 community groups that I referred to earlier. But now we have the community centers like the Asian Center, we have El Centro, we have the SENAC group, which is the Southeast Nebraska Native American Coalition, who are all doing prevention strategies specifically tailored for their community. So instead of inviting them to the bigger table, we've actually worked with them to get them the training they need to do prevention strategies within their own communities. So creating lasting family connections is one of those things. We also are utilizing the 40 developmental assets. So we're doing that. We also have the university on board who is helping us with some bigger pieces, some pieces that help us address the 18 to 20 population that is the goal within our grant. So we have a youth alcohol opinion survey that we are looking to put on the website that will help us down the road and allow youth to get on and do sort of a personal assessment of their alcohol use and how that might affect their goals down the road. We also are introducing a acute alcohol poisoning training so that folks who are 18 to 20 or even high schoolers can identify when somebody has had too much to drink and can get them help. So the university's been a very important partner. The university and the Nebraska Collegiate Consortium have been an important help reaching the older population, the out of high school population that's included within this grant.
Very good. Well, it certainly sounds like it's going to take a whole community in this effort. Thank you so much for joining me today.
Thank you.
When we return, we're going to hear some very powerful messages from youth in our community.
Teens drink 1/4 of all alcohol sold in Nebraska. That's 2 times the national average, 5th worst in the nation. But there's something proven to stop teen binge drinking. It's called parenting, and there is one parenting style that works best. Learn more about the parenting style that works against teen drinking. Talkaboutalcohol.org.
I think in college there's a lot of uninformed and consequently unsafe sex being had. We come to college, it's basically a land of complete autonomy, and we've been left by our parents, guardians, teachers to relatively figure it out on our own.
Going to a small parochial school, my exposure to talks about sex and alcohol, we're pretty much all in the vein of don't do those things.
Growing up when I was younger, I never really had anybody talk to me much about sex or the dangers of sex that can come along with that. And even coming to campus and starting off my undergraduate career, I never felt like I had too many people to talk to.
That leaves a lot of misinformation and sometimes complete voids of basic sex knowledge, but the sex is still being had. I remember my dad's attempt at the sex talk before dropping me off at college, which, by the way, is something that should have been talked about several years earlier. But I remember before he left, he said, okay, kiddo, be safe, use 2 condoms if you have to. And while in retrospect that's a completely erroneous thing to say, and it was meant as a joke, it stuck with me because I realized that he had always used humor as a way to get around having to give me honest information. And it left me feeling fairly cheated.
I was fortunate enough to get a job at the University Health Center, and part of my job was being able to conduct HIV tests for my peers. And I thought that this was really important because along with the HIV test itself, we were also putting together a reduction plan for these peers. And this gave them a really comfortable and relatable way to be able to come in and take these tests and reduce their risk of contracting HIV, and furthermore just having more knowledge on sex and all the things that come along with sex. And so a lot of the depictions that come with a college student is that every college student's out there having sex with multiple people and just getting really crazy drunk at parties. And we have quite a few statistics that show that, you know, while people are out and engaging in, you know, celebratory activities, they're not necessarily engaging in these dangerous sexual activities that involve multiple partners. A lot of these students are monogamous, and even with their partners, when they change partners, they are getting tested. They are very well aware of the things, and then you have people who aren't just as well aware. But that's, you know, a big part of being a peer educator is extending that knowledge to all my peers and making sure that they come out and get tested themselves.
So I think it's somewhat ironic that I'm here right now as like a peer educator on campus, getting paid to talk about those very things that were kind of swept under the rug going through high school. It's always been my opinion that it is better to be informed on topics like sex and alcohol, because otherwise you have uninformed people going out and have to figure these things out themselves, which is pretty scary when you think about it. And that's speaking from personal experience. I would implore parents, or even like adults in general, to be open to talking to adolescents about these topics. Tips such as alternating drinks with non-alcoholic drinks, or proper condom usage. Those might seem like common sense to most, but it's one of those situations where it can't hurt, might help.
I mean, I came to college without even having the sexual vocabulary to be able to describe my own reproductive anatomy. And when you think about it, that's terrifying. And so I think that we're doing young people quite a disservice and putting them in potentially dangerous situations when we don't give them the adequate tools to have safe sex.
So parents, don't be afraid to talk to your children about these things. This is something that they will encounter at some point in their lifetime. And it's better that when they do encounter these things, they have preconceived knowledge on what it takes, what it means, and what they should or should not be doing. And when they are doing these things, what they can do afterwards. And that makes all the difference for these kids, is just having that knowledge when the time comes.
An informed youth is much more likely, in my opinion, to make those responsible decisions, and make no mistake about it, knowledge is power.
So parents, don't be afraid to talk to your kids. We want to hear from you.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com.